Have you ever been fast asleep when a sudden, painful cramp in your calf jolted you awake? It can feel like your muscle has tightened into a hard knot, making it almost impossible to move your leg. For many adults over 50, this happens more often than they expect. But what causes these nighttime leg cramps? Are they simply a normal part of aging, or could they be your body's way of signaling that something needs attention? Today, we'll explore 7 possible reasons why your calves cramp at night when it's usually harmless, and when it's important to speak with a healthcare professional. Welcome to Daily Body Signals, where we help you better understand your body with simple, evidence-informed health information. Nighttime leg cramps are common, especially as we get older. While they're often not a sign of a serious medical problem, frequent or severe cramps deserve attention because they may be linked to lifestyle factors, medications, or certain health conditions. Let's begin with the most common reason. 1. Your muscles are tired. If you've spent the day walking, gardening, climbing stairs, or exercising, your calf muscles may simply be fatigued. Muscles work hard to support your body throughout the day. Sometimes, after repeated use, they tighten unexpectedly during the night. This is especially common if you've recently increased your activity level or spent longer than usual on your feet. The good news is that regular, moderate exercise helps keep muscles strong. Just remember to increase activity gradually and allow your body time to recover. 2. You may not be drinking enough fluids. Even mild dehydration can affect how your muscles function. Your muscles rely on the right balance of fluids and electrolytes to contract and relax normally. Hot weather, exercise, or simply not drinking enough water throughout the day can increase the likelihood of cramps. Many older adults also experience a reduced sense of thirst, making it easier to become mildly dehydrated without realizing it. A simple habit of drinking fluids regularly during the day may help reduce this risk. 3. You've been sitting or standing for long periods. Have you spent hours watching television, driving, or sitting at a computer? Or perhaps you've been standing for long periods while cooking or working. Remaining in one position for too long can place extra strain on the calf muscles. Taking a short walk every hour, stretching your calves, or gently moving your ankles can help improve circulation and reduce muscle stiffness. Small movements throughout the day often make a big difference. 4. Certain medications may play a role. Some prescription medications have been associated with the muscle cramps in some people. These may include certain medicines used for high blood pressure, cholesterol, or other medical conditions. That doesn't mean you should stop taking your medication. Instead, if you notice cramps beginning after starting a new medicine, discuss it with your doctor or pharmacist. They can determine whether your medication could be contributing and whether any adjustments are appropriate. Never stop prescribed medication without medical advice. 5. Low levels of certain minerals. Healthy muscle function depends on minerals such as magnesium, potassium, and calcium. If these minerals are too low, muscle cramps may become more likely. For most people, the best way to obtain these nutrients is through a balanced diet. Foods such as leafy green vegetables, beans, yogurt, bananas, dairy products, nuts, and seeds can all contribute to healthy muscle function. Unless recommended by your healthcare professional, avoid taking supplements simply because you have leg cramps. Too much of certain minerals can also cause problems. 6. It could be related to an underlying health condition. Sometimes recurring leg cramps may be associated with an underlying health condition. Examples include diabetes, nerve disorders, thyroid disease, kidney disease, or poor circulation. This doesn't mean every cramp indicates one of these conditions. However, if cramps become frequent, severe, occur every night, or are accompanied by swelling, numbness, weakness, or changes in skin color, it's important to seek medical advice. Early evaluation can help identify treatable causes. 7. Your sleeping position. Many people point their toes downward while sleeping without realizing it. This position shortens the calf muscles, making them more likely to cramp during the night. Some people find gentle calf stretches before bed helpful. Others benefit from keeping blankets loose enough that their feet can rest naturally rather than being forced into a pointed position. Simple adjustments like these may reduce nighttime cramps for some people. What to do when a cramp strikes? If you wake with a calf cramp, don't panic. Try gently straightening your leg. Slowly pull your toes toward your shin until you feel the muscle relax. Avoid sudden jerking movements. Once the cramp eases, gentle walking around the room may help the muscle recover. Some people also find a warm towel or heating pad soothing after the muscle relaxes. When should you see a doctor? Occasional nighttime cramps are common. However, arrange a medical assessment if they occur several times each week. The pain is severe. Your leg remains swollen or red. You notice muscle weakness. The cramps interfere with your sleep regularly. They begin after starting a new medication. You have diabetes, kidney disease, or circulation problems and notice worsening symptoms. Your healthcare professional can help determine the underlying cause and recommend appropriate treatment if needed. Let's quickly review the 7 possible reasons your calves may cramp at night. Muscle fatigue, mild dehydration, sitting or standing too long, certain medications, low levels of important minerals, an underlying medical condition, your sleeping position. The encouraging news is that many nighttime leg cramps are linked to everyday factors that can often be addressed with healthy habits and medical guidance when appropriate. If you found today's video helpful, please share it with a friend or family member. You could help someone understand why they're waking up with painful leg cramps. Now we'd love to hear from you. Have you ever experienced nighttime calf cramps? Comment cramp below and tell us how often they happen. I read as many comments as I can. And if you're new to Daily Body Signals, don't forget to subscribe for simple, evidence-informed health videos designed to help you stay healthier and more informed as you age.